class. Welcome to EdVantage. I'm Dr. Jodi Richardson-Delgado, and we're going to be talking about biopsychology today. So biopsychology is the study of how our biology affects our behavior and mental process. And biology, we're talking about anything from the brain and the neurotransmitters and the neurons that are in the brain, as well as our hormones, our endocrine system, all of these parts of our biology. We're going to start by looking at the neuron. We have about 100 billion neurons in our brain. Now we're going to go over some of the parts of the neuron itself. So at the very edge we have the dendrites. Those are the branches that you see off of the cell body. These receive the information from a sending neuron. These informations, or this information from the neurotransmitter, comes in through the dendrites, goes into the cell body. You can see that kind of circle that's at the middle in a teal color. Goes down through the axon, travels down to the terminal buttons, and at the terminal buttons, or terminal buds, you might hear that as well, they send the message to the next neuron. And that's how the communication goes through those neurons. Now, surrounding the axon, we have the myelin sheath. The myelin sheath is that yellow structure that you see kind of looking like little nodules around the axon. That actually speeds the information that goes through the axon. All of this works together to help send messages through our brain and into our body. So there's a space in between each of the neurons. The neurons don't actually touch each other. There's a space called the synapse, and it's in the synapse that the neurotransmitters exchange the information from one neuron to another. I'll explain more about this exchange of information in another video. So we're going to cover several different neurotransmitters in this video. However, please know we have identified over 200 neurotransmitters. Not all of them directly relate to behavior and mental process. However, many of them do. But these are some of the major ones that we look at in psychology: serotonin, acetylcholine, dopamine, and GABA. Now, serotonin sends an excitatory message, and this excitatory message stimulates the brain. Serotonin is very involved with mood, hunger, sleep, and arousal. When we have high levels of serotonin in our system, we're doing pretty good. We're feeling good, we're really not hungry, our sleep is pretty regulated, we're able to pay attention. As our serotonin levels come down, we see when we have a more mid-level of serotonin in our system, we might start to get worried or experience some anxiety. And then when we have low levels of serotonin in our system, this is where some individuals experience depression. We see a large number of people who are diagnosed with major depressive disorder also have low levels of serotonin. Now, please note that serotonin is not the only neurotransmitter that is involved with mood, hunger, sleep, and arousal. This is simplifying this process very much. The next neurotransmitter we're going to look at is dopamine. Again, dopamine sends an excitatory message to the brain. Dopamine is involved with our voluntary movements, our thoughts, and our emotional state. When we have high levels of dopamine in our system, this can lead to hallucinations and delusions, psychosis that we might see in schizophrenia. So many people who are experiencing hallucinations and delusions have high levels of dopamine in their system, and this is one of the reasons that they are experiencing this. We typically want medium levels of dopamine in our system. This allows us to function normally, it allows us to move our muscles voluntarily, our thoughts are clear, and our emotional state is pretty stable. When we have low levels of dopamine in our system, this can cause muscle tremors, much like you see in individuals who have Parkinson's. So it's not that low levels of dopamine would cause Parkinson's, but this is something that we see associated with the muscle tremors that we see in individuals who have Parkinson's. So the next neurotransmitter we're going to talk about is acetylcholine. Acetylcholine sends an excitatory message to our brain and in our system. Acetylcholine is involved in muscles, learning, attention, and memory. When we have high levels of acetylcholine in our system, it's almost like nerve gas. And if you've talked to people who have gone through boot camp in the military, they'll talk about this experience of being in a shed where they pump gas in and they're actually learning how to use their gas mask, but they have to be in that shed for a certain amount of time before they can put their gas mask on. And this is where their acetylcholine is raising in their system. And they talk about their eyes watering, their nose running, they're having a lot of difficulty breathing. And that's what it's like when we have high levels of acetylcholine in our system. We actually want mid-levels of acetylcholine in our system. When we have mid-levels or medium levels of acetylcholine, our muscles are working, we're actually able to learn things, we're able to process what it is that we are working on, we're able to attend what we're working on and lay down memories so that we can use them later. We're also able to recall memories from long ago or even just this morning. So acetylcholine is important for memory. When we have low levels of acetylcholine in our system, this is where we start to experience memory loss. And with individuals who are diagnosed with Alzheimer's, that is associated with low levels of acetylcholine. Now I want to be clear, low levels of acetylcholine does not cause Alzheimer's. It's that we see low levels of acetylcholine in individuals who are diagnosed with Alzheimer's. So now one of the treatments, not for Alzheimer's, but to help with memory loss, is actually a medication that can increase the acetylcholine in someone's brain and therefore allows them to remember a little bit longer. The next neurotransmitter we're going to talk about is GABA. Now GABA is one of the neurotransmitters that sends an inhibitory message. This tells our brain and our body often to relax. Stop activating so quickly. We need more GABA when we're trying to go to sleep. So GABA is involved with brain activity, emotional balance, as well as to help offset some of the excitatory messages. So when we have high levels of GABA, this is where our behavior might start to become uninhibited. So if someone were to drink alcohol to excess, this increases the GABA in their system. And when we think about someone who is drunk, we think about slurred speech. They may be blurting out things that might be a little socially inappropriate. Their balance might be affected. So when we have high levels of GABA in our system, it actually really affects the frontal lobes of our brain. So we're not able to make some of those executive decisions that we need to be making. We want to have a medium or mid-level of GABA in our system. This allows our brain activity to be active enough. It allows us to have some emotional stability and emotional balance, as well as offset some of those excitatory messages, especially if we have a fight or flight response. We need some GABA to help balance some of that out. When we have low levels of GABA in our system, we see this is where individuals might start to experience anxiety or even have some anxiety attacks. So we really need to raise that level of GABA for that individual, and a lot of anti-anxiety medications actually help with that. So thank you for joining me today. Stay tuned for another video on kind of the exchange of information between neurons. Thank you.